Yeah, you do see these taping done around the knee, around the ankles, around the shoulder, and around the back as well in sporting individuals. This is called as a kinesiology taping or KT taping. Now, how is this supposed to work? Mainly, the main advantage of this sort of taping is it is number one is non-invasive, and it has to be applied in such a way that it lifts the skin and tapes the surrounding area. At the same time, it has to allow the movement of the joint as well. So that's how it works. So it allows the movement of the joint at the same time working to kind of relieving the pain, relieving the swelling, relieving the inflammation. That's the background. I mean, that's how it is supposed to work. But if it is not applied properly, say if we stiffen the joint by applying that, or if it is too tight, or if it is coming off, and then the purpose is not served. So there is no hard evidence to say it is like a magic tape which is going to sort out the joint problems or sort out the injury. No, it's not the case. There is a minimal role where initially it helps in just holding that skin up and allowing the joint to move, and it will allow to continue with the game or support for some time. But it has to be applied by a well-trained person, because we need to make sure that it works when it is applied. So there are pros and cons to it. It can be applied, but again, the rehab is important than just applying the tape. It will allow the movement of the joint and non-invasive, and it can also sometimes act as a placebo as well. So the patient feels that, or the sports personnel feel that yes, it is there and it is helping them, and that can continue with the sport. But it is the rehab after that which is going to be the most important. And as I said, there's no hard evidence as to the usage of these taping to be.